Thanks, Michelle. So I'm going to talk about some of the uses of data. In case you don't know us, I work at the King's Fund. This is a charity that was given a pot of money by King Edward VII, which makes us able to be independent when we do research and work with organisations to improve health and care. So imagine yourself with your doctor as a one-to-one consultation. You're right at the left-hand side of this diagram, but your information from that small discussion will then broaden out and be used to improve care, to regulate services, to plan services, and for wider public health and public service development. So we're going to talk about how that happens and who's involved in it. And these numbers along the bottom of the slide are just to remind you of the scale. What starts with a one-to-one discussion with your doctor gets into this huge machinery of the NHS and public services. So let's have a look at how data is used for improvement. So whenever anything goes wrong in the hospital, if you have an incident, then someone will likely review your clinical record to work out what happened and how can we learn from it, how can we improve. You've probably heard of cases where patients are called back for a new scan. That's because they've detected a possible pattern of things going wrong, and a lot of patient notes will have been reviewed by a team of clinicians to do that. We have a similar thing for improving services, so to get people through the system better, so they have a better experience, and that will use information from patient notes to identify the problems, but particularly afterwards to monitor, are the improvements working? Are people actually getting better experience? And health services routinely set standards of what ought to happen and audit themselves against, are we achieving those standards? This is all very established in hospitals, but actually we quite often want to know what's happening along the pathway. So it's not just what went wrong in the hospital, but why didn't the GP know that they needed to do a follow-up appointment? Why didn't the care worker know that the new medication meant a higher risk of falls? So we're interested in how we can join up information about safety and improvement right along the whole experience of health and care, not just one bit of it at a time. That's the direction we're going in. Information is also used for regulation, so health and care services are inspected and rated, just like Ofsted does with schools. And to do that, the regulator will compare one hospital with another. Why is it taking 4 days for a hip replacement in this hospital when it only takes 1 in the other? So to do that, they have to have very comparable, good quality information. So in Mark's slide, he shows you all the data gets coded. So it doesn't matter what IT computer system you're using or what software, every hospital collects the same information so that it's coded and can be compared. And the analysts in the regulator need to do a statistical analysis to see how significant is this difference. So a couple of points there. One is, there's a whole industry here. There's an army of people who actually look at this data to assure quality across the NHS as a whole. And it's not necessarily cheap. You need quite a bit of investment because you have to have good data quality if you're going to share information for it to be useful. Just as with the other discussion about improvement, regulation is moving so that it's not just looking at the hospital on its own, it's looking at how the whole system works to assure standards of care for patients. So not just one bit at a time. So we need to share more information to enable that. Planning happens at many levels in the NHS, but the bit that I want to talk about is the people who are called commissioners, who are the ones who plan services locally and allocate budgets for them. We're quite good at this in many areas. We can say, in looking at the historical trends this year in Lambeth, Southwark and Lewisham, this area, we expect about 2,000 births. So we'll need this many midwives, we need this many places in our maternity unit. And we're quite good at that for things like births or heart surgery, where you can count it and it happens in hospitals, so it's all recorded very consistently. We're not so good at it when it's something like asthma, which isn't treated in hospital most of the time. The information's with the school nurse, with the GP, with the paramedic. How can we get better at that by sharing the information is the question. And that's the direction that we're trying to go in. But a note of caution, that the better you get at that, of really understanding, our A&E department's always really full, but when we look at what people are actually having in there, A lot of people don't need to be in an A&E department for that, so maybe we can save some money and downgrade to a minor injuries unit. It's not that getting better at understanding need means you'll automatically get more and more services, because the money can run out. Okay, public health. So when you have your consultation with your doctor, that is a one-to-one discussion. Public health is about improving the health of the whole local community, not individuals. So how this works is it's located in local authorities, in councils, because many of the things that determine health are not about medicine. They're about things like having green spaces, good air quality, that sort of thing. So a director of public health in each local authority will look at the health data and say, they'll say to the planning department, when you're planning that new housing estate, make sure you build into it cycle lanes so people can commute on their bike. Make sure there's green spaces where people can exercise, because our health data is telling us we've got too much overweight, we're getting heart attacks as a result, so we can make our environment more health promoting. In the last couple of years, we've had a lot of excitement about really linking up all this data across local councils and all the health system, which holds the prospect that we may be able to predict this person's going to have a heart attack in 20 years' time if they don't change. It gives us lots of time to put in place prevention strategies, or this person's going to develop diabetes. Lots of advance notice. We're not able to do that yet, but it's possible within the next few years. So who knows, if computers keep on developing at the same pace in 10 years' time, we might think of even more uses for this data that we've never even thought of yet, which might be good uses or might be bad uses of the data. Finally, just want to remind you of this slide that I think Dan showed last time we came together. What we're looking to do is to avoid this situation where it's only the patient who has the sight of all the services and how they need to join up. So we want to join up information across all of those different services so that they're more coordinated around the patient. And in doing that, we'll have to look at how data are used for improvement, regulation and planning. And what we're going to do today is go through a number of scenarios with you to really test out where are the things you're concerned about, what would make you have confidence in how we're using this information. So I'm going to finish there, and now we'll go back to our tables, I think.
Thank you, Alex. Can we give him a round of applause?